Is suicide a choice? That's the question David Covington addressed as he spoke to hundreds of attendees at the inaugural New York State Suicide Prevention Conference. Covington says society assumes that suicide is a choice, but there's a lot we have left to discover about the experience suicidal individuals encounter.
We have made assumptions about what that experience is like based upon our own life experience, sadness and disappointment, grief and loss, the ups and downs of being human. And we've assumed that those give us a real insight into the experience of being suicidal, of a debilitating depression and what that is like. And it turns out they don't.
If 1,000 years ago we took you...
During his speech, Covington talked about why so many mental health professionals have been taught that suicides are inevitable. He says it's a dangerous and pervasive myth in the healthcare industry.
Individual clinical staff have done their best and at times even heroic work to save lives. But the systems of care around them have done very little, and at some efforts have distanced themselves from this issue of suicide.
Covington says there's work to be done, and it starts with a conversation, talking to the individuals who have attempted suicide but survived.
Beginning to hear from people who made attempts, they thought they would die. The statistics suggested they might die, but they didn't. You know, ironically, we've really not talked to those people. There are people now coming out and talking, and we're learning from them. We're finally, really, it's like an eye-opening experience.
Without that narrative, he says, the silence that exists leads individuals contemplating suicide to feel alone in their struggles.
There's so much silence, there's so much shame, there's so much cloud of darkness around this that people struggling with suicide, they don't talk about it.
In his effort to challenge the idea that suicide is a choice, Covington even goes as far as to compare the internal struggle associated with suicidal thoughts to other healthcare battles.
This is more like cancer than not. People with cancer hang on, they do everything they can, and some finally lose their battle. They succumb when they lose all the strength, the assets, the resources, the supports, and when their strength and hope fails, then they die. That's actually very much like suicide. People hold on as long as they can hold on.
And as New York State rolls out its 1,700 Too Many plan, which addresses multiple areas of suicide prevention, its goal is to help people move to safer ground.